Hello everyone! Welcome to our channel, Bioverse, your colorful and easy way to learn nursing and health science. If you're a nursing student, healthcare learner, or preparing for exams, you're in the right place. Today, let's quickly review the normal vital signs for adults. Let's begin. First, let's look at the most commonly checked vital signs. Temperature. Normal range is 36.5 to 37.5 degrees Celsius. That's 97.7 to 99.5 degrees Fahrenheit. Remember, rectal temperature is slightly higher and axillary is a bit lower. Pulse or heart rate. Normally between 60 to 100 beats per minute. If it's above 100, it's called tachycardia, and below 60, it's bradycardia. Breathing ratio, normally 12 to 20 breaths per minute. Breathing should be regular and unlabored. Blood pressure. The ideal reading is 120 over 80 millimeters of mercury. Systolic pressure should be between 100 and 120, and diastolic between 60 and 80. Next, let's see a few more important parameters. Oxygen saturation, or SpO₂, normally between 95 and 100%. Less than 94% may indicate hypoxia, unless the person has a chronic lung condition. Pain. Always assess pain using a 0 to 10 scale, where 0 means no pain and 10 means the worst pain imaginable. Pain is called the fifth vital sign. Capillary refill time. Normally less than 2 seconds. It checks blood flow and peripheral perfusion. Blood glucose, or random, is the normal range of 4 to 7.8 millimoles per liter, or 70 to 140 milligrams per deciliter. Thanks for watching. If you found this video helpful, don't forget to like, share, and subscribe for more colorful nursing study videos. Stay tuned and keep learning, because knowledge saves lives.